Welcome to this learning opportunity that will address the topic of pharmacotherapy and tobacco treatment with your patients. My name is Jenny Glennon, and I'm working with the New Hampshire Tobacco Prevention and Cessation Program to get the word out about how to use the available quit smoking medications to support your patients to successfully quit tobacco. This is one of 4 modules available to increase your knowledge and skills in working with your patients who use tobacco. The time you spend watching this video will help you work more effectively with your patients. You will learn new ways to engage patients in a productive conversation and help them make a durable quit attempt. During the next 30 minutes, we'll talk about the benefits of supporting patients by using one or more of the FDA-approved medications to support their quit attempt. After this lesson, you'll be able to describe the 7 FDA-approved medications to assist patients in quitting, and explain the benefits and contraindications of each of the medications. Also, you'll be able to describe the free NRT available through QuitNow-NH. Nicotine addiction, like other addictions, is a chronic brain disorder with both physical and behavioral components. Nicotine is a chemical stimulant found in cigarettes and other products. The use of medications to support quitting helps individuals cope with the physical aspects of the addiction, while they learn new coping skills to deal with the behavior and psychological aspects of not using or quitting. Medications help manage the urges while the patient learns to deal with their triggers and their environment and their personal rituals for smoking. Your patients will have the best results when all aspects of addiction are addressed. In general, the use of cessation medications coupled with behavioral coaching doubles the quit rates compared with placebo. This learning activity will cover key information about each of the 7 FDA-approved medications for quitting. The first category of medications that we'll cover in this learning activity is nicotine replacement therapy, or NRT, which comes in many forms. Some of the various forms are the transdermal patch, the lozenge, gum, nasal spray, and inhaler. Using NRT is beneficial because it provides a lower dose of nicotine and slows rising plasma nicotine levels, which interrupt the pleasurable feelings that you get from smoking. Depending on your patient's level of dependence, they will need varying doses or maybe combinations of NRT. Use higher doses and combinations for more dependent smokers. A quick way to assess dependence is to ask patients, how long after waking do you have your first cigarette? Smoking within 30 minutes of waking is a good indication of high dependency. All forms of NRT are shown to have comparable efficacy, but in a randomized trial, compliance was greatest for the patch, lower for the gum, and very low for the spray and inhaler. Which forms a patient chooses should be based on how easily it fits into his or her lifestyle. Patients should be advised to completely stop smoking upon initiation of NRT. It's also important to note that a single cigarette contains about 10 to 25 milligrams of nicotine. So let's break it down and look at each type of NRT available. First, there's the patch, which is available in several trademark brands like Nicoderm, as well as generic versions. The patch comes in various doses of 7, 14, and 21 milligrams. 21 milligrams is the highest dose available over the course of a day and almost equivalent to smoking about a pack of cigarettes per day. For those who use electronic cigarettes or vape, their level of dependence is more guesswork. The nicotine found in e-cigarettes comes in a liquid with a range of levels starting at 0 nicotine all the way up to the highest level of 36 milligrams per milliliter. The highest amount represents the amount you might get if you smoked a pack and a half of cigarettes per day. So if your patient smokes a pack of cigarettes or more, recommend that they start by using the 21 milligram patch. Your patients will also need to decide whether it's best to wear the patch for 16 or for 24 hours. Patients with any sleep issues or sleep-related side effects while wearing the patch should consider wearing it for only 16 hours during the day. And patients with strong cravings first thing in the morning or first thing when they wake should consider wearing the patch for the full 24 hours. After a couple of weeks, they should taper down to the 14 milligram patch and eventually the 7 milligram patch. Patients can be instructed to apply the patch to a clean, dry, hairless, intact portion of skin on the trunk or upper arm of the body. Press the patch firmly in place with the heel of your hand for about 10 seconds, and if necessary, hair may be clipped, but make sure to instruct patients not to shave the area as that can cause irritation. Also, patches shouldn't be cut as that affects the release of nicotine. Some other tips to share with patients who are having a hard time getting their patch to stick is to switch to a soap that's free of any moisturizers or lanolin, not to use any lotion or moisturizers to the area that they plan on applying the patch, And also it is okay to use adhesive tape or medical adhesive on top of the patch to keep it from lifting. Nicotine gum and lozenges are available in several trademark brands like Nicorette, as well as generic versions. The gum and lozenges both come in 2 and 4 milligram doses. We can use the same question as was used earlier to assess for the most appropriate dosing. Patients who smoke their first cigarette within 30 minutes of waking should use the 4 milligram strength. Otherwise, the 2 milligram strength is recommended. Like the patch, gum use should be tapered down over a 12-week period. It's also recommended that to increase the chances of quitting, use at least 9 pieces of gum or 9 lozenges per day during the first 6 weeks of quitting. Patients can be instructed to use 1 piece of gum or 1 lozenge when the urge to smoke occurs. Proper use is key in getting the best results and minimizing side effects from the gum and lozenge. Some common side effects could be nausea or upset stomach. To use the gum properly, instruct patients to use the chew and park method. Patients can be instructed to chew slowly until the gum tingles, and then place the gum between the cheek and the gum until the tingling is gone. Repeat this process until most of the tingling is gone, and that should take about 30 minutes per piece of gum. For proper lozenge use, patients can be instructed to slowly dissolve the lozenge over 20 to 30 minutes. Make sure not to chew or swallow, and occasionally move the lozenge from one side of the mouth to the other until it's completely dissolved. Also very important to let patients know they should not eat or drink 15 minutes before using the lozenge or gum or while they're using the lozenge or gum. A less commonly used form of NRT is nasal spray. Nicotine nasal spray is available in the trademark brand Nicotine-NH and is not available generically. Each dose involves 2 sprays and contains 1 milligram of nicotine. It can be used by spraying 1 or 2 dosage, which is 2 to 4 sprays per hour, with a maximum of 5 doses per hour and a maximum of 40 doses per day. Do not exceed 3 months of treatment with the nicotine nasal spray. It's also recommended to increase chances of quitting, patients should use at least a minimum of 8 sprays per day. To minimize side effects, patients should be instructed not to sniff, swallow, or inhale through the nose during administration. The nasal spray is not a commonly preferred NRT method due to cost, contraindications, and unpleasant side effects like nasal mucosa irritation. The final form of NRT available is the inhaler. The Nicotine Inhaler is available in the trademark brand Nicotrol and is not available generically. Each inhalation cartridge contains 10 milligrams of nicotine. Cartridge use depends on nicotine cravings and previous smoking history. The manufacturer recommends using between 6 and 16 cartridges per day with a maximum of 16. To achieve the best effects from the nicotine inhaler, patients should be advised to use via a continuous, frequent puffing over a period of about 20 minutes. Use is recommended for 3 months and then should be slowly tapered. Use beyond 6 months is not recommended as it has not been studied. The inhaler should be used with caution in patients with bronchospastic disease due to potential airway irritation. Now let's discuss combination use of NRT. A review of NRT showed that people who used 2 different forms of NRT had higher abstinence rates than people who used only 1. A nicotine patch can be used to deliver a steady stream of nicotine, while ancillary products like the gum, inhaler, or lozenge can be used to help with intermittent cravings. Now let's discuss some populations of people with special considerations regarding the use of NRT. First, for pregnant women, the recommendations for NRT are a little bit more complicated. The U.S. Public Health Service guidelines in the American College of OBGYN states NRT should be considered only after other methods are tried and the risks of continued smoking and the use of NRT are understood. The FDA considers nicotine as a pregnancy Category D medication, meaning there is evidence to show harm to the developing fetus. These professional groups state that patients should have a clear resolve to quit smoking. Therefore, it's not that pregnant women cannot use NRT, but it should be used as a last resort only. Also, it's prudent to prescribe doses at the low end of the effective dose range and consider the use of formulations that yield intermittent rather than continuous drug exposure, such as the gum or the nasal spray. Also, we want to use caution for patients with cardiovascular disease like underlying serious arrhythmias, serious or worsening angina, and recent myocardial infarction within the past 2 weeks. Nicotine may cause adverse cardiovascular effects by increasing the myocardial workload through increased heart rate and blood pressure. Nicotine also may constrict coronary arteries, leading to cardiac ischemia. Discontinue use if irregular heartbeat or palpitations occur. However, we always want to remember the risks of NRT in patients with cardiovascular disease is small relative to the risk of continued smoking. You may find now that a lot more of your patients are using electronic nicotine delivery systems, or ENDS, also known as e-cigarettes or vaporizers. The FDA does now regulate the manufacture, import, packaging, labeling, advertising, promotion, sale, and distribution of ENDS. The FDA Center for Drug Evaluation and Research regulates products marketed for therapeutic purposes, like the products that we had previously discussed. Currently, there are no FDA-approved ENDS to help people quit smoking, as there is no safety and efficacy information to substantiate the claims or the use of these products. Additionally, beginning in 2018, FDA regulations will require the product packaging and advertisements of all ENDS to bear the following warning statement. Warning, this product contains nicotine. Nicotine is an addictive chemical. Now let's switch gears and discuss the two non-nicotine FDA-approved cessation medications. First in this category is the sustained-release bupropion, also known as Zyban. The mechanism of action for this agent, originally marketed as the antidepressant Wellbutrin, is largely unknown, but it's thought to be due to its capacity to block neuronal reuptake of the neurotransmitters dopamine and norepinephrine, to reduce cravings for nicotine, and also reduce the symptoms of withdrawal. Patients should initiate bupropion therapy 1 to 2 weeks before their quit date, starting with 150 milligrams once a day for 3 days, then increasing to 150 milligrams twice a day thereafter. It's important to start the medication before the quit date because steady-state therapeutic levels are reached after about 7 days of therapy. Some patients have reported insomnia, headache, dizziness, or dry mouth, but these problems usually lessen with continued use. Some patients also find that taking the second dose in the late afternoon or early evening may help to decrease the symptoms of insomnia. Because seizures have been reported in about 1 out of every 1,000 patients taking bupropion, its use is contraindicated in patients with a history of seizures or factors known to increase the risk of seizures, including a current or previous diagnosis of bulimia or anorexia, central nervous system tumors, and concurrent use of medications that can lower the seizure threshold. Because seizures are dose-related, patients should space doses by at least 8 hours and not exceed a total daily dose of 300 milligrams. Studies of healthy smokers suggest that bupropion may be safely and effectively used in combination with NRT to increase cessation rates. Bupropion is classified as a pregnancy category B medication, and its use has not been studied in pregnant women. Thus, it should be only considered when other non-pharmacological methods are ineffective. Cessation rates in patients who use sustained-release bupropion are generally 2.1 times higher than those observed in patients receiving placebo. Some of the advantages of using bupropion include an oral formulation with twice-a-day dosing, no risk of nicotine toxicity if the patient does continue to smoke, also can be used in combination with NRT, and it may be beneficial for patients with coexisting depression. Chantix or Varenicline is the next non-nicotine cessation medication available. Briefly, Varenicline works by blocking the effects of nicotine on the brain. Some patients have reported experiencing nausea, insomnia, headache, vomiting, drowsiness, trouble sleeping, unusual dreams, changes in mood, or changes in taste. The standard dosing titration for Varenicline is 0.5 milligrams once a day for 3 days, then increased to 0.5 milligrams twice a day for 4 days, then increased to 1 milligram twice a day thereafter for up to 12 weeks. A dose reduction should be considered if a patient is unable to tolerate the standardized dose of Varenicline due to side effects. Patients may want to consider setting a quit date up to 35 days after the initiation of Varenicline. Some data and studies suggest that an extended pre-treatment regimen may result in higher abstinence rates. There was a black box warning, the FDA's most serious type of warning, with the original release of Varenicline for serious mental health adverse reactions. The original warning for increased risks of serious adverse reactions on mood, behavior, or thinking with Varenicline use has been lifted, as the risk is lower than was previously suspected. This recent study highlights that though the risk of these mental health adverse reactions are still present, most patients experiencing the reactions did not have as serious consequences as was previously thought. Although the box warning has been lifted, the risk of these mental health adverse reactions is still present, especially in patients currently being treated for mental illnesses such as depression, anxiety disorders, or schizophrenia. The results of the trial confirm that the benefits of smoking cessation outweigh the risks of these medications. Regardless of the type of pharmacotherapy used to help a patient quit smoking, it's important to consider the other medications that a patient is taking as well. Nicotine and tobacco smoke may impact how a person metabolizes or even responds to other medications that are frequently prescribed. These possible interactions may require medications or therapies to be adjusted throughout the cessation process as tobacco smoke and nicotine exposure are decreased. The QuitNow-NH website has a fact sheet with a list of medications to monitor when a patient quits. The website for QuitNow-NH has all of the information and resources you would need to support your patients in an effort to quit smoking. You'll find referral forms and promotional information to conveniently refer your patients to QuitNow-NH, formerly the New Hampshire Tobacco Helpline. QuitNow-NH provides free coaching and quit smoking support and information on the availability of free NRT. The first e-learning lesson in this series covers all the details of the services and how to make a referral. Thank you for joining me today and for all of your work to help your patients address their tobacco use. You provide them with valuable, evidence-based information on effective ways to quit smoking successfully.
Thank you for taking the time to complete this module. To receive a Certificate of Completion, or CEU, for this lesson, you need to complete the two-part assessment. The links are at the QuitWorks New Hampshire website for you to click through to a survey.